Well, good afternoon, everyone. Welcome to the June 14th edition of the weekly COVID situation report from Peterborough Public Health. Thank you for joining us today. I hope you're well and had a good weekend. My name is Brittany Cadence. I'm the Communications Manager for Peterborough Public Health, and very pleased to have with us several of our community partners, including local enforcement agencies and some of our elected officials, and also several of my colleagues here at Peterborough Public Health and from the media. So to get us underway, I will start us off with a land acknowledgement. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, and to kick us off, we have with us Mayor of Selwyn Township, our Board of Health Chair, Andy Mitchell. So I will turn it over to you, Andy. Please go ahead.
Thank you, Brittany. Friday marked the beginning of step one of reopening. We have arrived here because of the hard work of area residents who have diligently adhered to public health measures and have gotten vaccinated in large numbers. To each and every one of you, a big thank you. Many people welcome the opportunity to expand their activities. The ability to dine out on a patio, shop in additional retail locations, or go camping has all been appreciated. This careful and measured opening, particularly focused on lower risk outdoor activities, is scheduled to be in place for a minimum of 21 days so that healthcare experts and government decision makers can evaluate the impact. This is an important time for many of our small businesses who have been severely impacted by the shutdown. They and their employees have contributed significantly to our community's safety, and I ask where you can to avail yourself of their goods and services. Although the end is finally in sight, and the light at the end of the tunnel may actually be the sun and not a freight train rushing towards us, we need to continue our two-part strategy. First, get vaccinated with a first and then second dose as soon as you can. And second, continue to practice common sense public health measures. Don't assemble inside your home with others than your household members. For those of you spending time at your cottages, this is not the time for indoor or overnight guests just yet. You'll need to wait until step 2, currently planned to start in July. Don't assemble outdoors in groups more than 10. Continue to keep a physical distance of 2 meters. When distancing is not possible and where required, wear a mask. Continue to wash your hands frequently, and if you feel ill, stay home and get tested. We have come a long way in the past several weeks thanks to the hard work and dedication of so many people. Our community has pulled together, supported each other, and made the sacrifices that were necessary. We are so close to being able to return to normalcy, but we need to be disciplined and to push through to the end. Together, we will heal our community, attend to those who have suffered, and build back better. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, next we have the latest statistics. So I'll invite Dr. Salvaterra, our Medical Officer of Health, to walk us through these next few slides. Please go ahead, Dr. Salvaterra.
Thank you, Brittany. So we continue to see daily new cases in the single digits, and they tend to fluctuate between 1 to 6 cases each day. However, the total number of active cases has increased by 6 since last week. It now stands at 35. And we have seen a substantial decrease in the number of close contacts. We are currently down to 38 high-risk contacts that we're following. That's down from 80 last week at this time. The majority of our new cases continue to screen positive for the Alpha variant, and we are reporting 24 more variant cases since last Monday, but we have also received confirmation on Saturday of our first case of the Delta variant. And it is still being investigated, but serves as a good reminder that to everyone that we do need to get our second dose as soon as we are eligible to do so. Next slide, please. Last week, we reported a total of 26 new cases, and that was 2 fewer than the week prior. Next slide, please. It gives me great pleasure to report that we currently have no active outbreaks in our community. The last 2 outbreaks at Riverview Manor and workplace number 11 were declared over on Saturday. Next slide, please. Starting at the right-hand side of the slide, you can see that our weekly incidence rate for the week ending June 13th, it was 16 cases per 100,000. That's just slightly higher than the previous week, but you can see in this graph that all of our case incidence rates in both Peterborough and in our neighboring health units continue to decline, which again is very good news. Next slide, please. We just wanted to show you the 14-day case incidence rates for the province and to highlight that there are several areas that are purple, which indicates greater than 80 per 100,000. So it's not just the GTA. And you can see that our health unit to the north there, Porcupine, is also dealing with high cases, and that's due to the Delta variant. And this slide, I believe, reinforces the importance of limiting our interregional travel. Next slide, please. Let's move to vaccination. So the numbers continue to climb significantly. Currently, over 93,000 local residents have received their first dose. And this is 8,000 more than last week. And we have almost 4,400 more cases that have been reported, 4,400 more that we are reporting on our local COVID tracker. We now have over 16,000 cases who are fully vaccinated. That's in the green, and that's 4,500 more than reported last week. So in terms of our vaccination rates, you can see from the pie charts that we have now reached over 75% of our local residents with at least 1 dose. And we are at almost 40% of our youth aged 12 to 17 with their first dose. That's a 16% jump for the youth since last Monday. We certainly hope to have this increase even more after our dedicated youth clinics this week. So the numbers of eligible residents who are not yet vaccinated continues to shrink, and that's where we need to focus our efforts. We have still over 29,000 local adults over the age of 18 who've not yet had their first dose, and we have close to 5,000 adolescents aged 12 to 17 who are eligible but not vaccinated yet. And so we need to do our best to reach those people in our community. Many of our provincial and local indicators are showing positive signs, but we do remain in a race against time to reach those vaccination targets while we continue to follow our public health measures. We now have evidence that the Delta variant is here in our community, and it does serve as a good reminder that the provincial reopening must proceed gradually and safely, which is why we released special instructions to our local businesses and workplaces last week. More than ever, we need to do our part, both as patrons in public establishments and in our personal social settings. The instructions for businesses include critical workplace protection measures, such as active COVID-19 screening, non-medical mask use by employees, and the use of personal protective equipment, which includes medical masks and eye protection when workers are required to be within 2 meters of others without a physical barrier. If an employee does not wear an appropriate medical mask and eye protection and does come into contact with someone who then tests positive for COVID-19, they will be deemed to be a high-risk contact and they will be required to self-isolate for 14 days. So for businesses, the operational impacts of having employees self-isolate can be very significant. Therefore, compliance with public health instructions for screening, for distancing, and for wearing both masks and eye protection will protect both the business and the employee's health. For the rest of us, going about our daily lives, we still need to follow general public health measures, such as screening for symptoms each time before we leave home, staying home when we're ill, getting tested, and if we do go out, wearing a mask and maintaining 2 meters of physical distance. We've urged residents to avoid crowding at beaches and on the trails, and if parking lots are full, to please come back later. We've checked in with our enforcement partners this morning, and preliminary feedback is that we did have some issues over the weekend at Sandy Lake Beach. So we can direct any of your questions to our OPP representative here with us today. The safest way to take advantage of the patio dining is to dine with household members only. If choosing to dine with others, ensuring everyone has had at least 1 dose of a COVID-19 vaccine more than 2 weeks prior would help to reduce the risk of infection. Even though patio dining is outdoors, for unimmunized individuals, sitting across a table, eating and drinking for up to an hour can be risky. Staying outdoors to socialize reduces but does not eliminate the risk. When socializing outdoors, in a park or in the backyard, please make sure to spread out and maintain at least 2 meters distance at all times, unless you're part of the same household. An easy way to do this is to set up those seating arrangements ahead of time and asking your guests to remain seated. Not all indoor spaces can accommodate the maximum amount of 10. So please do your measurements first to determine how many guests are safe to gather and then issue your invitations. On the vaccination front, the Delta variant hotspots in Ontario are currently Porcupine, Peel, Waterloo, and parts of Toronto. Areas like ours with fewer people, relatively fewer people immunized, do have a higher risk for the Delta variant, as we have a greater proportion of unimmunized individuals. Data from the UK does demonstrate that even 1 dose of a COVID vaccine is not enough to stop the Delta variant. That 1 dose confers only 30% of immunity. So to really stop the Delta, we need to have people fully immunized with 2 doses. Canada is now reporting the world's highest percentage of first doses, and I strongly encourage everyone in Peterborough to book your second dose as soon as you are eligible. With regards to second doses, the province announced over the weekend that those who received their first dose of AstraZeneca vaccine can now book their second with a shorter interval. So that means that with informed consent, individuals can choose to get a second dose of AstraZeneca or to get a messenger RNA vaccine as early as 8 weeks and up to 12 weeks, recognizing that while 12 weeks helps to ultimately provide more long-term protection, some may choose to receive their second dose sooner at 8 weeks to benefit from that increased protection of a second dose. All of these options provide protection against COVID-19, including the Delta variant, and they have been deemed safe. Most local residents here in Peterborough who received their AstraZeneca likely are already at the 12-week mark, as they were immunized early as part of our primary care pilot. However, for those who received it from a pharmacy, you can now use the provincial booking system to book your second dose at either a local mass immunization clinic, or you can go back and get it at a pharmacy again. Our local primary care practices are hosting AstraZeneca clinics starting this week in the evenings at the Evinrude Centre for their patients. And then in July, they will be hosting messenger RNA vaccine clinics for those who are choosing to get a second dose of Moderna instead. Everyone who received their first dose of AstraZeneca will be asked to attest that they've completed the informed consent form available on our website and also on the website for the ministry. And if you have questions, please consult with your healthcare provider or call telehealth if you don't have one. As for access to the vaccines, we are expecting a very large shipment of Moderna each week for the next 2 weeks. So thank you to our federal partners. And I ask you to check online for the booking system daily. But in the meantime, there's lots of Pfizer and Moderna availability at our 26 local pharmacies. So they may provide you with both fast and convenient access. So I'll leave it at that. Thank you so much, Brittany. Back to you.
Thank you very much, Dr. Salvaterra. Okay, so joining us from our elected officials, we have MP Maryam Monsef, as well as I see Mayor Diane Therrien. But maybe Maryam Monsef, if you would like to start, if your camera is cooperating, I'm happy to spotlight you. Go ahead.
Thank you so much, Brittany. Hello, everybody. Happy Monday. Bonjour, Anin. Salam alaikum. I'm on Mississauga and Anishinaabe territory. And Dr. Salvaterra, I'm part of the 75% in Peterborough who's received their first dose. And I am so grateful for the smooth, seamless process the volunteers and public health workers at the Evinrude have enabled for us all to take part in. It didn't hurt. I was greeted with a lot of warmth. People were respecting the rules, and I can't wait till I can go back in that lineup and get my, second dose and put this pandemic behind me. I think we all are. Dr. Salvaterra, thank you so much for your leadership, and Chair Mitchell for yours. I'll just give a quick update on Moderna. As Dr. Salvaterra mentioned, there is a large influx of Moderna coming into the country. We expect 2.9 million doses to arrive in the coming days, with the distribution to the provinces beginning immediately. A further shipment of 4.2 million doses will arrive closer to the end of this week, and the distribution will continue throughout the weekend. and into next week. This means 7.1 million doses of Moderna are arriving in the coming days to be distributed over the next 2 weeks. Nearly 2.8 million of these doses will be sent to Ontario. And based on the current provincial allocation and the distribution methods currently in place, there should be about 25,000 Moderna doses that are going to be Peterborough's share. Combined with our Pfizer doses, Canada will be receiving 11.9 million doses over the next 2 weeks, which brings our cumulative total to 43 million doses arriving in Canada by June 26th. Canada is #1 in the G7 and G20 in first doses administered. I know this is something that Canadians take a lot of pride in. So let's be #1 in the world for second doses as well, Canada. And I know that Peterborough will continue to lead the way. Lastly, Dr. Salvatierra, and to everybody who's worked so hard to get us to this point, we appreciate you. And, like so many others, I enjoyed that taste of freedom this weekend to be able to go into patios, to do so safely. And I did that. As much as I enjoyed my time out, there was still anxiety for me knowing that the variant, particularly the Delta variant, is here, that we've still not conquered COVID fully, that while we've seen progress, as Andy Mitchell reminds us, this is not victory and that we are not there yet. So everybody, keep up the great work. Let's support our frontline workers and essential workers. Hang on tight. Use these freedoms carefully. Enjoy them cautiously. Look forward to Canada Day and get that second dose so that we can move on from this really, really difficult pandemic. Thank you so much, Brittany. Back to you.
Thank you very much, Miriam. Okay, so Mayor Therrien, if you've got any remarks you'd like to share, please go ahead and I will put you up on the screen.
Thanks so much, Brittany. Thanks, everybody. It's good to be here. I know that we're all excited again about reopening, and I too was downtown this weekend, and it was great to see that sort of sense of life coming back and everybody really wanting to get out and support our local businesses. But again, as we've heard, we need to continue to be safe, to continue to abide by public health guidelines because we aren't out of the woods yet. I know a lot of us have gotten our first dose. I was lucky to get mine last week. And happy to work with the health unit and anybody else to try to get the message out, particularly to younger folks, to step up and get vaccinated and to push for the second dose when it's available. And thanks for all the work being done to make more vaccines available to more people in our community. So just wanted to, again, highlight the need to continue to support local. You'll notice all the changes made in the downtown to facilitate patios and extra space to make things safe. If you have suggestions or comments on that, please feel free to reach out to the city. We're happy to hear what people think about it and continue to, be safe and be kind, as Mayor Mitchell said, because we're not at the end of this yet, but we're getting there. So thank you so much. Back to you, Brittany.
Thank you, Mayor Therrien. Okay, so now we get a chance to hear from our media guests. If you've got some questions for our speakers, and as I mentioned, we do have representatives both from the Ontario Provincial Police and the Peterborough Police. So let's start with Joelle Kovac from the Examiner. Are you ready to ask some questions?
Sure, thank you very much. I'd love to know more about what these issues were that Dr. Salvatierra alluded to at Sandy Lake this weekend. What occurred there?
I wonder if our OPP partners might be willing to comment on that. Staff Sergeant Chris Scagliazza, do you have some comments to share?
Hi, Brittany. Yes, I'm here, and to answer Joelle's question, the site itself was very busy throughout the entire weekend. I know in a joint media release from Peterborough Public Health, the city and county and all the townships, And our policing partners, we asked that people just be mindful of space. If the parking lot was full, not to rehash what Dr. Salvatierra has already said, but if the parking lot's full, please come back at another time. What we saw over the course of the weekend was just people en masse, parking lot being full, people parked in the no parking zones along Lakehurst. County bylaw was on site, or municipal bylaw was on site trying to move the vehicles from parking illegally. Other than that, just it was congregation in large numbers. So that was the issue.
Okay, has that been an ongoing issue at Sandy Lake?
So Sandy Beach is an area attraction for sure. Outside of COVID times, it's a very popular spot. And now when we have to be mindful of the 2-meter distance at the very least, just people aren't observing that.
Okay, any charges?
None from this weekend. Again, when officers were on site, it's very difficult when there's that many people. We do have the ability to disperse. That would create a larger enforcement issue in and of itself. So because charges haven't been laid at this point, it doesn't mean that there isn't any forthcoming, but most of the other sites throughout the county, beach waterfront, people did heed the public health recommendations and warnings. So kudos to them, but specifically no charges as of yet from Sandy.
Thank you so much. How about for city police? Have the anti-lockdown groups, was there still a protest this weekend, and how big was it?
Hi, Joelle. So essentially there was a small gathering on Saturday in front of City Hall, approximately 30 to 40 people maybe present. No concerning issues. Again, for the most part, they were within their own groups that they've been with for the past several weeks. And there was nothing untoward or problematic that was reported.
Okay, so were there any charges, or were there any religious gatherings where there may have been police?
There was no charges laid from the weekend event. We're trying to move towards the transition as well of opening up, and again, taking on that educational component, responding to complaint-driven situations. And again, no information regarding any religious gathering that I'm aware of that was brought to our attention.
Okay, that's wonderful. I would have a question for Dr. Salvatierra about the emergence of the Delta variant. To be clear, I guess if it emerged on Saturday, that means it may have been in the community for a little while, like a couple of weeks, right?
You're right, Joelle. It takes about 2 weeks to do the genomic sequencing. So the individual who was identified actually became symptomatic the last week in May. And this, we have a household cluster. So there's more than one case. I'm assuming that everyone is positive with the Delta, but we have asked Public Health Ontario to screen the other cases with genomic sequencing. It'll be 2 weeks before we get confirmatory results, but we're treating this as a Delta cluster.
There, okay. Thank you very much for that. Okay. Yeah, I'm gonna allow my other colleagues to ask questions now. Thanks.
Okay, thank you very much, Joelle. So Reg Watson from the Examiner, any follow-up questions?
Yes, a question to Honorable Minister Montseff, if she's still on the line. Where are the shipments of the AstraZeneca vaccine, given that we're telling people that they can now get their second dose after only 8 weeks, and hundreds of people in Peterborough would have had AstraZeneca as the first dose, yet where are the shipments?
I wonder if I should answer that question.
I imagine you're up on it too, sure.
We have received AstraZeneca here in Peterborough, and we have enough for everyone who's received their first dose. So, so the shipments are here with us in the refrigerator.
Okay. Thanks for that then.
Okay, I assume that's it then, Reg. So I will move on to Mark Genta from Global News. Go ahead, Mark.
Hi, Dr. Salvatierra. Just wondering on this potential cluster of Delta cases, do you have any idea of possible numbers with that? And are they only a group of people that like live together or were in contact with each other?
So far, the testing is showing that it's a household cluster, so they all live together. I believe we have 4 symptomatic and either tested or presumed positive in the cluster, but we are continuing to investigate and because we do need to be very sure that we have this under control.
Just my apologies, you probably did say it before. Just when was this case identified?
So the first person to become ill in the household became symptomatic the last week in May.
Just on the Moderna shipment, do you have numbers as to how many we're going to be getting in the area in these 2 large shipments?
I do. Let me, if you don't mind, I will check my notes. So we are due to get close to 4,000 doses of Moderna later this week. It'll be delivered possibly over the weekend. And we can ask for more. So we were told that if we wanted to hold a special Moderna clinic and needed more vaccine, that the province does have some in reserve, and that we might even be able to get more than that those 4,000 doses. We don't have the doses for next week yet, but it's predicted to be a similarly large shipment. So I wouldn't be surprised if it isn't the same or more.
On a Moderna only clinic, is this something that the health unit is looking to do?
We often do Moderna only clinics. I mean, either both Moderna or Pfizer are, I would say, they are equally good vaccines, and so we will do the only reason we don't do them both together is that we don't like to mix vaccines in a clinic, because it does set you up for more errors. So we tend to do one vaccine only. And right now, the only difference between Moderna and Pfizer is that Pfizer has been authorized for 12 years of age and over. I understand Moderna has actually submitted for authorization by Health Canada to be used in adolescents, and that we may get that news sometime in the next couple of weeks.
I'm just wondering how we're doing on Pfizer shipments.
We continue to get good amounts of Pfizer. I believe we're getting about 8,000 doses of Pfizer each week.
Okay, thank you.
You're welcome.
Okay, thank you, Mark. I saw Joelle Kovach's hand up, but it looks like it's down now. But if you had a question, Joelle, I'm happy to come back to you. But not seeing it, perhaps you can put it up during the next reporter. So let's go to Greg Davis. Oh, I do see your hand. So let's hear from Joelle, and then we'll go to Greg Davis. Go ahead.
Yeah, no, I'm just seeking clarification. Thank you for taking my question about AstraZeneca. You may have explained this and I may just not have grasped it. Do you mean like there's enough in the city for those who went to pharmacies as well, or are we talking about just those folks who got it? I'm just confused as to where those people are left.
I believe because so it's up to individuals to decide whether they want a second AstraZeneca or if they'd like to switch and get a messenger RNA. And there's polling that's been done in the province that shows that about 30% of first dosers are going with a second dose of AstraZeneca. So that said, I believe we have more than enough AstraZeneca. We've got over 4,000 doses. It'll soon be close to 4,400 doses in the fridge. That will be more than enough for everyone who had a first dose. Certainly, if we see the same trend in about 30% of them going with a second dose. In fact, I'm hearing from primary care that they're getting close to 50% of people who are booking for a second dose of AstraZeneca. And even at 50%, we still have enough.
So how do those people who would have gotten it at a drugstore, do they then go on the COVAX system and indicate that they were a first dose AstraZeneca? And are they asked whether they want a second, or how does that work?
Yeah, so as of this week, people who received an AstraZeneca dose can go online and through the provincial booking system can book to get a messenger RNA vaccine with us, because public health we're not immunizing with AstraZeneca. That's primary care and some of the pharmacies, but not pharmacies here in Peterborough. The other option for people who had an AstraZeneca, certainly through their primary care provider. And I know that some people who received it in a pharmacy are calling up their primary care provider to see if they might be able to get it through their primary care, and that they are taking care of that. We're not involved. But then the third option is to go either back to the pharmacy for an AstraZeneca dose or to get a messenger RNA vaccine. We have here in Peterborough this week, our pharmacies received over 1,000 doses of Pfizer and about 5,000 doses of Moderna. That's 26 pharmacies here. So they have lots of messenger RNA vaccine to be able to do that second dose.
Okay, I don't think it's really easy for people to understand what they're supposed to do next, frankly. I'll try to explain it as well as I can. But...
We count on the media to help make it easier, Joelle. I understand there's just so much happening right now, and we're doing our best to explain it. And I thank the media as well for doing your best as well to bring that information to the public. We do have our website. So that's another good source of information, and certainly people can talk to their healthcare provider if they're confused, or they can go online to the provincial website as well.
Okay, thank you so much for taking my question. I was really confused.
Okay, thank you. And of course, Joelle, if I can help at all, just pop me an email and happy to clarify as needed. I'm going to move on to Greg Davis now, and then Reg will get to your question. So go ahead, Greg.
Dr. Salvaterra, regarding appointment availability, we're still receiving inquiries from viewers and readers that they can't find local appointments and they have to end up going elsewhere. How busy are the appointments?
They go quickly. So I would say check daily for online for appointments in our mass immunization clinic. We we post them as soon as we can confirm them. We are continuously posting new clinics, so people can actually be very happy when they find out that there's lots of availability and that the wait isn't too long. So I would say check back often, but also in the meantime, reach out to the pharmacies, because they are also going to, each week, they'll be getting more vaccine. And so they are going to become more and more a really dependable source of vaccines here in Peterborough. So for the long term, pharmacies will play a larger role.
Okay, thank you.
Okay, great. Thank you, Greg. So we'll hear from Reg Watson and then we'll move on to Trent Radio. So go ahead, Reg.
Yeah, it was just a quick follow-up on the pharmacy piece. So some of the pharmacies that initially offered the AZ then switched to Pfizer. Will they be switching back temporarily to AZ, and is that happening soon? Or will they be offering both at the same time? Just walk us through how that would work.
Yeah, so here in Peterborough, we had most of our AstraZeneca, the early AstraZeneca was actually not delivered by pharmacies. It was delivered by primary care. I believe we may have had 3 or 4 pharmacies that had some initial supply of AstraZeneca. My understanding is that they will get additional AstraZeneca to provide their customers with the choice of getting a second dose of AstraZeneca, but it's not very large. We had very small numbers in the pharmacies here. Most of it was primary care.
Okay, thank you.
Great. Thank you, Reg. Okay, Rob, are you with us from Trent Radio? Please go ahead.
Hi, yes, I am. Thank you very much. 2 questions for Dr. Salvatierra. The first one, so we've talked a bit about I guess a whole bunch about the second doses of AstraZeneca. Is there any news about second doses for the mRNA? I think the last I had heard it was still at people 70 and over, or there was a date. Is there any news on when that might expand for accelerated second doses?
So for the Delta variant hotspots, they opened up today for people who I believe had their vaccine, let's see, before on or before May 9th. So they can go in, get their second doses in the hotspots. For the rest of us, the province is weighing their decision this week. They're certainly very engaged. We're being surveyed for our opinion, and that survey is due at the end of the day today. So I wouldn't be surprised if we see more decisions being made regarding accelerating that second dose access.
Okay, wonderful. And then my next question is about the reopening. I think you had mentioned last week that there was the possibility with respect to outdoor dining of bringing in a similar order to last time about restricting it to members of the same household, even if that's not necessarily a provincial restriction. Do you have any thought on whether that's something that we might do, or what perhaps would spur Peterborough Public Health to take that decision?
Well, we'll watch the numbers, and again, if we start seeing increased cases, and if the cases actually are linked to outdoor dining, then that would be rationale to issue an instruction to try and close that down a bit to more lower risk situations where it's household members only. So we are very, I must say, I'm a little nervous, but I'm delighted that people are back in the downtown, and I'm delighted to see people, outdoors and enjoying the opportunity to be back on the patios. But we are going to watch that very carefully over the next couple of weeks to see how it goes.
Right, and I suppose it would take a couple weeks before we see any indications to make a decision based on.
Yes, I mean, the exposures started Friday. So we are just 3 or 4 days into it, and typically it's a 10-day incubation period, and then by the time people become symptomatic and get tested, another couple of days. So it'll take about 2 weeks before we know for certain.
Okay, great. That's everything from me. Thank you very much.
Thank you, Rob. All right, let's hear from Matt Latour, and then we'll move on to Paul Rellinger after Matt. Go ahead, Matt.
Perfect. Just one question for me. It has to do with the Delta cases. Do you know if they were vaccinated ahead of time, or are they unvaccinated people?
No, I'm afraid I don't have that information, Matt.
Perfect. And you said they were symptomatic. Are they all just self-isolating at home, or are any of them in the hospital?
No, they're at home.
Awesome. Thank you.
You're welcome.
Great. Thank you, Matt. Okay, Paul, please go ahead if you've got some questions for Dr. Salvatierra or our enforcement partners.
I do for Dr. Salvatierra. Thanks so much. Sorry, just going back to the Delta cluster, I want to clarify, there was one Delta contacts?
I'm sorry, you cut out a bit there, Paul. Can you say that, ask me again?
I'm sorry, going back to the Delta case, there was one, I believe there was one case and 3 close contacts. Is that right?
Yes, in the household.
Okay, and they're all in the same household.
Yes.
Okay, thank you. I thought I heard that, but I just wanted to clarify. I just wanted to ask you a quick question, if I could as well, about that number of people that are not vaccinated with the first dose. Pretty high number, 29,000. I know you don't hear from all 29,000, but do you have a sense of why these people aren't vaccinated? Is it refusal to get vaccinated? Is it, you know, is there any indication? Because that is I think you'd admit that's a pretty high number.
Well, I think much of it is due to the fact that we haven't had the vaccine here as long as it's been available in the hotspots. As you recall, it's only, you know, we opened it up, but later. I think people just need more time to book their appointments. I mean, I know looking ahead, we have lots of booked appointments. So I think it's just really a matter of time.
Okay, great. And I just wanted to ask a quick question about the outbreaks. I was trying to remember back, but this has got to be one of the few weeks of the pandemic that we've really had no outbreaks at all. There's usually been 1 ongoing, 2 ongoing, and you know, would you agree that it's been a while that this has happened?
Yes, I would agree that it's been a while. And I think if you, we might be able to check back and see when we last had 0 outbreaks, but it may have been last year, potentially in the summer when we were, when we had that nice little 40-day break with no cases. I would assume that we also were free from outbreaks then.
Okay, thank you, Dr. Salvatierra. That's all I have. I appreciate it.
Okay, great. Thank you very much, Paul. I'm not sure, Reg, if you had another question or if that's a hand from before. But if you had a question, go ahead and ask it.
That was a hand from before, but actually, if Brittany, if you could follow up on when the last week was that there were no outbreaks in these jurisdictions.
Sure, I can send an email to that effect. And all of our outbreaks are listed on the COVID tracker. There have been a total of 50 so far, and they all list their start dates and their end dates. Right. So that information is there, but I can have a quick look. Okay, so I think that is the end of our media questions. And before we go, though, I would like to provide an update about our COVID tracker and our reporting schedule. So starting this week, the local COVID tracker on our website will be updated on weekdays only. So there will not be any updates this weekend. However, starting next Monday, June 21st, weekend data will be shared by 12 noon on Monday. So you'll see the aggregate data over the weekend provided on Mondays. And then the updates will continue throughout the week by 5 p.m. from Tuesdays to Fridays. So I just wanted to make sure that was clear for anybody. The other change in our reporting is we are shifting our vaccination data, which is presented weekly, to Wednesdays from Thursdays. So that means this Wednesday, June 16th, you will see the previous week's vaccination statistics. And that is so that when we start meeting for these media briefings on Thursdays on the 24th of June, we'll be able to share with you the previous week's current vaccination data. So if you have any questions about that, feel free to send me an email. But I did want to just acknowledge those couple of changes that are coming to our COVID tracker. So with that, we will be meeting back here on Thursday, June 24th, and I will send out an advisory with the meeting link to that media briefing, as well as all subsequent briefings happening on Thursdays going forward for as long as we have cases to warrant it. Okay, thank you everybody for your time and for your good questions today and for your help getting the messaging out there. So we will see you back here in a week and a half. Take care.
Thank you, Brittany.
Thank you.